I'm Tondre Buck. I'm here at Gibbs Cancer Research Institute. I'm one of the Hem-Onc physicians. I'm from the University of Mississippi, where I practiced 5 years before coming here. What Hem-Onc means is that I treat benign as well as malignant or cancerous hematologic malignancies. So the way to look at cancer is that you have what we call solid tumor, things like breast, lung, colon, and then what I treat mostly is blood cancer, cancers of the blood, or some people say liquid tumor. An example would be leukemia, myeloma, lymphomas. I see across the board, of course, I don't see any adolescent or pediatric patients, but my patients range from, 20s to ever, until 20 and until. So I see a wide variety of patient ages. A wide variety of treatment that can range from pills in the outpatient setting to being inpatient, getting intense therapy for a month, or being in the hospital for a month. So very wide range of treatment options. You have some diseases where if you don't do any treatment, you can die in weeks. I have other things, but if you get on treatment, you have a chance for curing, living a long time. Some of the cancers, depending on the rarity of them, makes them a little more difficult to treat compared to more common cancers. In most cases, it's probably not a death sentence if you get diagnosed and get treated properly, but some of the blood cancers are tough to treat, just like some of the solid tumor cancers. There are probably, and this is just a guess, probably hundreds and hundreds of different types of blood cancers, okay? All of them have a variety of different prognoses, but I think most important is that just because you get it doesn't mean you're going to die, but you need to get to the appropriate person, which is us here at Gibbs, and we can take each individual case. Just to give you an example, myeloma, for instance, which is a blood cancer that affects a particular cancer cell. Survival used to be dismal, now it's not dismal anymore. Leukemia, that's a tough one, but once again, you can cure that. So each individual cancer has to be treated different. You just need a specialist there that can kind of walk you through the process. The way you find success in cancer is that you get everybody in the room at the same time to discuss the individual cases. So at any given point, you can have what we do in terms of giving chemo, radiation oncologists, surgeons, pathologists, and our clinical research people around, all focusing that attention on that one patient case.